some half kneeling. For those of you who don't know, half kneeling is just down on one knee. And we are going to be working on the mobility of your ankle, because we know that if you can't go into a squat because your ankles won't let your knee go forward, you're going to go backwards in your squat. And that's a problem, because it's either you fall backwards or you fold in half. And if you have a bar on your back, or if you have weight in front, you're going to probably round your back, and that's not going to feel very good in the long run. So we need good mobility in our ankles. And I'm going to take my weight. I think this is just 15 pounds, but you could go, you know, as much as you're comfortable with, going right on the top of your leg. You also don't need this weight here, but we're just going to pitch forward. So I want your knee to track over your toes. I have also my big toes down and back, just getting a little big toe mobility, because why not? It's good for you. And I'm going to pitch as far forward as I can while keeping my heel down. If I start going forward and my heel comes up, I've met my limitation. Okay, it's a self-limiting exercise. And so this just adds a little bit of pressure. You can also push down with your hands. I like the weight because then I don't have to work as hard. And we're just going to do 10 of these on each side. Then we're going to build on this by doing a plank with heel raises to kind of feed a little stability into our trunk. Maybe take some of the neural drive to our calves away so we can go through greater ranges of motion. Once again, all leading up to a better squat at the end. I'm going to show you a little trick. If you do have that loop band, I'm going to show you a way to maybe mobilize your ankle a little bit more if it's stiff. I have it here. Might as well show it to you. We got one more to go. You'll see I'm really able to get my knee far forward. There's nothing wrong with that. I think I put a post out like last month or 2 months ago about why it's actually okay and maybe needed to let your knee go over your toes in your squat. It's healthy, it's natural, it's normal. Okay, we're going on to the other side. If you have this loop band and you want to try this out, be my guest, okay? It's a mobilization for your ankle. This band is way too loose to really have too much of an effect on here, but if you have a tighter band, this is a great option to travel with, maybe to, you know, throw in your gym bag before you go do squats in the gym. You want to make sure that that band is below these little prominences on your ankle. They're called malleoli, those little ankle bones that we've got. You want to make sure that the band is underneath those, and I've looped it around my other thigh, but if you're in the gym, you can loop it around a rig, a bench, something that's not going to move. So the pull is going to be backwards, and I'm going to pitch forward. So what this is doing, this is pulling on a bone in my ankle called the talus. And the talus is kind of what is the hinge joint, or the hinge aspect of our ankle, but also it's shaped like a dome, so it allows us to have all that range of motion, all degrees of motion. But when we pull it back, it allows us to get a little bit more dorsiflexion, or this movement right here. And so this is, like I said, this band a little bit too easy for me. I could also add this weight in. I think I got like 4 more to go. But we're doing mobility, so we're not necessarily stretching out the muscle. We're more concerned about what is the joint doing of our ankle, because we're going to get a little bit more of the flexibility component coming up next with a plank and some heel raises. Like I said, today is just a very broad day. Let's just get some movement. Let's stay healthy. Maybe a little bit more low-key than a HIIT workout or one of the workouts you're doing in the gym, or maybe it's Barry's or SoulCycle or whatever's open near you these days. I know those are all closed in LA, but maybe you're still able to get to the gym wherever you are. So we're going into a plank with the heel raise. I'm just looking at my board of what we're doing. We are going to need that band today. I know I said I don't think we need it, but okay, so we're going to be getting into a plank, whether it's on your forearms or your wrists. That option is up to you, okay? If your wrists are bothering you, just on your forearms. And we're going to be down here, normal plank, right? I'm squeezing my butt, I'm squeezing my abs. I'm going to drop, let's see here, I'm going to drop down as if I were dropping my heels off a step. And then I'm going to push forward as if I'm doing a heel raise. And I'm going to drop down, get a little bit of a stretch in my calves and my Achilles. We're going to go for 10. And I'm at 3. And we're working on our big toe mobility with these two, which is so important for when we're running, for our mechanics of the way when we walk or jump or do anything athletic. We need great big toe mobility, or we will change the way we move our lower body. It'd be like if I told you to put your thumb in a brace or your wrist in a brace and then try to move it around or throw a baseball. It's pretty tough to do. It's going to really change the way that you move your elbow and your shoulder. And we got one more to go. Okay. We're still going to keep this in the trunk stability vein, okay? So things that are really good for stability of your trunk, building up the strength of your midsection by doing a hollow body. Now, a lot of people aren't necessarily familiar with hollow body. They call it whatever they want, maybe a leg raise or something like that. But basically, it's a plank turned over. So you're going to be on your back, your legs are in the air, your head and your shoulders are in the air. So we're going to add a little component of hip flexion to it because we want strong hip flexors. We want hip flexors that know when to be on and when to be off. If we just don't actively concentrate on strengthening our hip flexors, a lot of times they'll just tighten up because we're staying in this shortened position a lot. Yeah, we stand, but sometimes if they get short enough and they bother you enough and we start to call on them to stabilize our trunk, they can cause some pain, maybe a sway back. Sometimes there are some issues going on there. Sorry, my dog's coming out. So what we're going to do is we're going to lay on our back. We're going to put your band around your feet. And if you don't have your band, that's okay to do this one without your band. But it will help in providing some resistance to your hip flexors. You're going to go in a 90-90 position, tabletop for those of you who do Pilates. Your hands are going to be up towards the sky, your palms are up towards the sky. You're going to lift your head and chest. Your legs go out. So right now I'm in the hollow body position. Feel my abs working, feel my obliques working. And I'm going to pull my knee up past my hip joint. It has to come up past my hip joint so I really get my psoas and my iliacus. And I'm changing. I'm going to do 10 on each side. If you need to take a break and reset your hollow body, please be my guest. I might have to do that. 4, 5. And so we're using those hip flexors, telling them when to go on, when to go off. And then we're going to do one more drill before we do a hip flexor stretch, because then they're nice and supple. We've got them nice blood flow. They're perfused, be supple, and ready to stretch. Okay, got 2 more on each side. 1, 2, and 2. Okay, so we're going to stay on our backs. We're going to move the band around your knees. So we're going to be actually stretching our hamstrings by activating and using our hip flexors, keeping one leg in the air, and then actively extending. A lot of times I have us do this holding here. If you need to hold behind your leg to keep it up, that's okay. Make it your stretch. But if you can, I want you to have a little bit of resistance in your band. So you're having to use your hip flexor and your quad to keep your leg up. And then you're going to be stretching out your hamstrings. So the hamstrings are a terrible pelvic and trunk stabilizer. They'll do it if they need to, but if that's the case, you might find yourself being the guy who goes to do a glute bridge and your hamstrings just cramp and they cramp and they cramp. And that's basically your hamstrings trying to stabilize your pelvis while also creating hip extension, overwhelming the system. It's confusing logically as to what you're asking your hamstrings to do, and they just fire all out. That's all a cramp is. So if we can get your hamstrings to kind of relax and realize that they are just hip extenders and they prevent too much hip flex. So you want to get some resistance in your band. I'm really working, using my hip flexor, stabilizing my trunk, and then kicking my leg straight 10 times. Your down leg does not have to be straight. As you can see, I got a little bend. It's just providing the right amount of resistance to kick my hip flexor and my trunk into effect. We got 4 more. Ooh, a little tighter on this left side. I have started to reintroduce barbell deadlifting into my life this week. A little effect on my hammies, my calves, my glutes. All know that something new has been introduced into my routine, that's for sure. So we're going ankle, calf, knee, hamstring, core, all of this stuff working with one hip flexors. 2 more. Okay. Now we can ditch the band for a little bit. I don't think I see anything else on there. Whew. All right. But we're going right into a hip flexor stretch. Now, I do want to show you the option of the rear foot elevated quad stretch, hip flexor stretch. This one's up to you. If you want to just pop your knee down 90 degrees in the front leg, toes are tucked underneath, and if you tuck your hips, you come up, you might feel a really good stretch here in your hip flexors, especially after the last 2 things that we've been doing. That's great. That's your stretch. But if you don't feel a great stretch, but you also don't feel comfortable reaching back here, maybe your balance is off, one, you can hold on to the chair if you prefer, or get your foot up on the chair, a little bit more passive. You can just come up here. Now, I'm more of a fan of grabbing my ankle and just making sure that I have good trunk stability, but this might be what you prefer depending on where your balance is. We're gonna just be here 60 seconds. Feeling this in the front of your leg. You don't wanna be crunching your low back. You don't wanna be compressing your spine while you do this. If you're doing that, just move your body forward, okay? You'll still get that quad stretch, but we don't want to lean back. Leaning back isn't going to provide you more stretch. It's just going to provide you more compression in your low back. Whew. All right, I think we're at about 20 seconds left. And I'm going to switch legs. Maybe you turn around. Maybe you stay on this side because it's a little more tight. You want to give it a little extra love. This is your time, right? I'm just kind of guiding you through, giving you some options of what to do, help you feel a little bit better or feel your best. Work on maintaining a healthy spine, healthy hips, healthy knees, and healthy ankles. Okay. So, pro tip, if you stand but don't move your front foot, you step to it, you should be set up perfectly for the other side. So I feel a good stretch here. I'm going to reset my pelvis. So I'm going to posterior pelvic tilt and then come up, try to get as much stretch as possible. Staring off into the distance, we have a nice little lemon tree in our yard that hasn't had lemons on it for a while, but it is full. A couple more weeks. Good to go. All right. We got about 30 seconds left. Where are we after this? Oh, so after we've stretched our hip flexors, we really want to use this extension. Maybe we've been able to get our quads and our hip flexors to relax a little bit, and we can access more range of motion in our hip. Well, if you don't use that range of motion, your body's kind of going to forget that you went ahead and improved it. So we're going to do something called a cook hip lift. It's just a single leg bridge, but we're pulling our knee all the way up into our chest. It really forces you to keep a stable lumbar spine or a neutral lumbar spine, so you're not overarching your back when you do it, kind of like this. Really forces you to access your glute. Now, if you don't look high, you know that maybe you have in front of your hip, you have in that inefficient position of your hip, your glute really struggles to fire. I think about 5 seconds left. Okay. Don't put your chair away too far, okay? We'll be coming back to it for some squatting. But for your Cook hip lift, it's named after a PT out there. His name is Gray Cook, and he is a very, very smart guy. You should seek him out. He's got a lot of great info on movement, in exercise in general. But what you're going to be doing is you're going to pull your knee up to your chest. So what this is going to do is this is going to basically force you into a posterior pelvic tilt. And by holding your knee up towards your chest and then bridging, you're not going to be able to fall into that all too common pattern that people get to when they bridge of arching your back. So if I pull myself into a posterior pelvic tilt and I keep it there, I then have to use my glute, and just my glute, not my back extenders, to produce hip extension. You know, you might find that keeping your thigh up towards your chest or your stomach is a little bit too hard. Give yourself a little slack, and you can gain this as you work on it over time, as you stretch out your hip flexors more, and we're doing 8 of these on each side, sorry. So if you need to, just bring your knee away from your chest a little bit. That'll give you a little bit more room to cheat, but that's okay. You're not really cheating, you're just doing what you can. And that will improve over time as you stretch and as you get stronger. You got 3 more to go. 2, and I really feel that left butt cheek going. Like I said, started doing some deadlifts throughout my day. Whew. Okay, so we're switching sides. Knees coming up towards your chest, bridging up nice and high. And like I said before, if you're getting that cramping in your hamstring, maybe it's because your hamstrings are working a little bit too hard throughout your day, and your glutes don't really know what to do. So your hamstring tries to do it all. And then it's not a potassium issue or a magnesium issue and eating mustard and eating pickles or whatever they're having people do sometimes isn't the issue. It's more of a motor control issue. It's your body trying to recruit stuff too often. You'll see I have to actually bring my knee away from my chest just at the very top to get the extension I want in my hip. Where are we at? Okay. All right, so we've already done planks, but we're gonna do some baby planks. Call them baby planks because babies do this. But also they're shortened, so it's got 2 names, or 1 name with 2 meanings, double entendre. There we go. And it's a baby plank. If you ever see a baby push itself up on its forearms, it then can lift its hips as well. And it's one of the ways that we develop shoulder stability, trunk stability, and hip stability all at the same time as we're going through our developmental sequence as kids. But it's also a great way to reestablish those things as adults. Yeah, sure, our body weight is a little bit more, obviously. We're distributed a little differently. We don't have these huge heads that babies do, so it's actually easier for us to do this than it is for them, which is actually really impressive when you think about it. I think if we were proportioned correctly, 20% of our body weight would be our head if it were the same as a baby. So I'm about 190, so 20% of that, I would have a 40-pound head. That would be a sight to be seen for sure. So we're going to go into a plank, and then we're going to stay on the hands and knees, or in that world, and do something called the knee pump, which is a great portable exercise for your quads. It's also really good to introduce something similar to squatting to people who have maybe arthritis or patellar tendonitis and can't handle a full body weight squat. So we're going to be going into plank position, so down on your stomach. You'll see why it's a baby plank in a second. So I've got my palms down. I'm up here like a baby looking around. And the first thing we're going to do is I'm going to push my shoulders away from the ground as much as I can. From here, I'm going to lift my belly button, my pelvis, and then my thighs up off of the ground. I'm not pushing my butt way up here. I'm basically in line from my hips to my shoulders and just breathing. We're going to be here 30 to 45 seconds, somewhere in that world. If you need to reset, somewhere in the middle, be my guest. But it's important that you keep breathing. So I'm talking. I know that's exhaling. I can't hold my breath. I'm shaking like crazy. Get the exchange from the ones that can't release those 2 pillars of air. And it's forcing my spinal stabilizing system, so all the little guys around the spine, as well as release abs, all that good stuff. But it's definitely the small learning how to stabilize properly. If I did more of these, I would have less shaking. Okay. One, because I'd be stronger, but what is strength? Strength initially is a gain in your neuromuscular control. Okay, so it's the nervous system getting more efficient and understanding what it needs to do, not the muscles necessarily growing and having hypertrophy in those areas. So when that shaking stops, it basically means your body's accustomed to doing that and it can do it efficiently. All right, so the knee pump. The knee pump is basically butt up in the air a little bit. It's like a bear crawl. Push up position with the hands, fingers are facing forward. You're gonna drop down, but your knees don't touch the ground, and then you push up. Down, and then up. And we're gonna do 10 of these, and you should feel your quads start to work. And there's ways to add resistance to these, but I say if you're doing some squatting. But if you have arthritis or patellar tendonitis, these are a great option to decrease the load. They're portable. You don't need ankle weights. You don't need a bench. I think I got three left, something like that. And then we're gonna need our chair. 2 and 3. Okay, so a little bit of quad work. We've been stretching, we've been using it. We're all nice and limber and loose. Okay, so I got my chair. Now, you have 2 options. You got resistance or you got assistance. I mean, you could go with body weight here too, but I'll leave that up to you guys. So a lot of times when people think about pistol squat, that's that, squat. Let's see if I can do this on this unstable surface. One leg down all the way and then back up. It's really intimidating. There's a lot of pieces. You need great ankle mobility, you need great spine and hip mobility, that kind of thing. But there's ways to regress it that are really beneficial. Once again, if you don't have a ton of equipment, you can make squatting difficult by taking one leg away. But some people can't do a single leg squat. And so then it's like, oh, well, what do I do? Well, 2 leg squats are a little bit too easy with body weight, but if all you have is body weight and a chair, the chair elevates you a little bit, and so it makes it a little bit easier. And so if you are just doing these, like I said, I got that unstable surface, we've got single leg squats to a reduced depth, making it a little bit easier. But maybe even that is a little bit too hard, but double leg squats are really easy. You could go for days with those. So what you can do is you have that one leg, and then you put your other heel down on the ground. You're gonna move your working leg back a little bit, hands are out in front, and then you're up, and you're down. You're able to modulate the amount of pressure you have in your working leg with your heel. Gradually, as you get stronger, you can lift that foot. And so, go ahead and do 5 more wherever you're at. We're just learning something here. Have a little bit of resistance. Now, you shouldn't have resistance if you still need assistance. That one doesn't make any sense, really. What we want is to work on balance and control first. But if you have that, we want to load it up a little bit. 2, 3, 2 more, 4, and 5. Nice. So we're going to switch and we're going to do 8 on the other side. Now make sure you're not going to miss your bench or your chair. If you need to, remember, assistance or resistance. I'm going to go with resistance, and maybe then I'll drop down to assistance as I get more tired. 3, 4, because we're moving on to single leg deadlifts with the weight. Next, 2 more. 1 and 2. And I got to give props and respect to all those fitness instructors who are doing these live workouts and are able to talk a lot better than this while they're doing all these weights and jumping around and stuff like that, because this is exhausting to do while we're talking. All right, so single leg deadlifts, one of my favorite exercises, king of the hip hinge, even more so than a barbell deadlift because it incorporates balance, it's portable. You can use it for a mobility drill. You can load it up a lot more and spare your back more so than a barbell deadlift. And that's a single leg deadlift. You can do this with lots of weight or you can do it with a little weight. Today, find your weight, okay? Like I said, I got 15 pounds. It's nice. This is more of like a greasing the groove. I'm gonna make sure that my reps are really, really good. I'm focusing on my balance, having a nice neutral straight spine and getting my glutes to fire. So we're gonna go with a moderate method, okay? So there's There's an easier method where it would be if I'm holding the kettlebell in my left hand, my left leg is the working leg. This makes it easier to balance because the weight isn't as far from my working leg, okay? This makes this hip work harder. This is easier. Choose whichever one you like. I like the opposite because of the anti-rotation that I have to create in my trunk. I'm gonna make 8, and the goal isn't to touch the floor, the goal is to make good reps. So if you can't get down to the floor, don't get to the floor. You wanna make sure that your back leg is straight. You kind of drag it back until it lifts off. Slight bend in the front knee and hip. We got 6 more. 1. If you need to hold on to something, please do. Doesn't have to be a balance exercise. At that point, you're working primarily on strength and mobility. 4. Finish up with a nice mobility drill. Incorporate some mobility. Okay, I think I got it. Just 8 more on this side. I'm sticking my hand out here to kind of counteract the weight being so far away from my hip. 2. But you can keep it close. You can put it on your low back to kind of see, am I arching my back a lot? Am I rounding my back? Because we don't want reps that look like this, okay? If you got that turtle back while you're doing it, I want you to really focus on having your back leg straight, squeezing that butt, and that's gonna help you maintain a nice straight spine, or low back at least. We got 3 more. 2. 3. All right, so we're done with the weight. But we have 5 more squats to make. Now you might need to elevate your heels. You might not be able to get down as far as I can, and that's okay. We're working up to it, right? A lot of times I get asked, what can I do to make my squat better? That's a very loaded question because we have so much to work on, from our ankles to our knees to our hips to our thoracic spine. Any one of those pieces has the ability to alter the way we squat. And this little drill can affect a lot of them. It's a prying squat with thoracic rotation. So prying squat is just when you go down, you get your knees between your elbows between your knees, and you kind of pry your hips apart. So we're working on stretching your adductors, a little bit of your hamstrings there. But from here, I'm going to put one hand down. Other hand comes up, and now I'm working on my thoracic spine. Put the other hand back down, open up the other way, and then coming back up. And go back down, open up. And we got 3 left. Nice and tall for your chest. And we got 2 left. Feet are straight ahead if you can. And we go. Last one. And then after you're done this one, I want you to stay at the bottom of your squat. And there we go. Okay, so we are getting a little assessment. How do you feel? Is your back tired? Is your back sore? Or your ankle sore? The front of your shin's killing you. I think I was bit by a bug. Is it really hard to not round, or is your neck really killing you? Can you get nice and tall? We're just making a physical assessment of how we feel. And I figure I'll take this time to let you know that in about a month, I'm going to be sending out a notice that for 15 days, I'm going to be sending out mobility drills to work on improving your squat. So many people have asked me what you can do for improving your squat that I feel like, all right, there's got to be a way I can help people. And so what it's going to be is every 5 days, I'm going to send out an email. It's going to have GIFs, written directions, videos, that kind of thing, with 4 drills and 1 bonus drill with various methods to do each. Okay, so you might have like method A or method B to mobilize your ankle or your hip. And you work on those things for 5 days. And then you retest your squat. And then you're going to get the next email. Same thing. Work on those for 5 days. You retest your squat. The third one goes out. Retest your squat. Because I think that we can make a lot of change as long as we focus our attention on one thing, right? The intention would be to improve your squat. There's so many pieces to it that you're going to get one thing for your ankle, one thing for your knee, one thing for your hip, and one thing for your thoracic spine. in every single email. There's going to be, like I said, different ways to do those. Maybe you can't do a pigeon pose comfortably, so you have to do a modified table pigeon or something like that. So keep your eyes out for that. That's going to be going out in about a month or so. I just got to put all the emails and videos together because I think that we have the room to improve, right? We're back home again. We're sitting more. We're less active because we can't get to our gyms. Well, guess what? The way we move is going to be affected. Now I want to make sure that we, are able to maintain general movement function. Where are we at? Great. So keep your eyes peeled for that. You're going to be improving your squats. You're going to have to do work every day for it for 15 days, but I think that you'll see a huge payoff in the end